I'm Ali, I'm one of the physios from treatmyachilles.com. We're an online specialist service treating and rehabilitating Achilles tendon problems, particularly Achilles tendinopathy. And if you would like to find out a bit more about our service, you can see the link below in the information on this video. What I want to talk to you today about is the top 5 reasons why your Achilles might not be getting better, even if you are doing all the things that you've read about or you've come across or you've been advised to do. Our first reason is, have we got our diagnosis correct? Is it what we think we're treating? And in this example, we're talking about an Achilles tendinopathy or tendinitis or tendinosis, any of those words. So with an Achilles tendinopathy, you can either have 2 different types. The first type is the mid portion, and the mid portion means the middle section of that Achilles. So if it inserts into the heel at the bottom, it's that middle section that may be tender to squeeze or have a lump. And if you're not sure whether you've got this, we've already got a video to say, how do I know if I have this Achilles tendinopathy? And again, the link will be in the information below. If you don't have that, you may have pain a little bit lower, and that lower pain right where it inserts into the heel is then called an insertional Achilles tendinopathy, and again we have some videos on those with the link below. Different types of those tendinopathy may mean that the exercises or the advice that you're given may differ. So for example, the Achilles tendinopathy, when it's near the insertional point, may not like being stretched more than the mid portion, when you compare it to the mid portion, I should say. So what I mean by stretch is if you've read exercises where they're saying about dropping off a step or doing calf stretches, what you're doing there is moving the insertion closer to that heel bone when you're dropping off a step or doing those stretches. So if it is a bit uncomfortable, it's like pressing on a bruise and aggravating it. So again, we may give different exercises depending on that diagnosis. If you're unsure, it's worth speaking to a professional. Other things can also mimic an Achilles tendinopathy or cause an Achilles tendinopathy, and those components need to be treated as well. For example, your sciatic nerve runs out of your back, runs through your bottom, your hamstring and your calf muscles and down into that foot area. So if there is tension within that system as it travels past, or if your nerve, which slides and glides and moves up and down your leg, is not able to do that as much because of the tension in those soft tissues or those joint stiffnesses, or there's other reasons why that might not be happening, then it can irritate those structures as it goes past. And if you think about a rope being non-contractile, i.e. it's a single length, where it would then feel the most tension or irritation would be down the bottom of it, and down the bottom of it is near that Achilles tendon. So what we then would need to look at is, what are all those other structures that sciatic nerve travels past? Does it move as freely as we would hope? If we did some specific tests, does it recreate your tendon pain? And then there is just some simple exercises or different things that you can do to where that tension is to help that diagnosis out. You may also have other things that can be contributing to that Achilles tendon pain, and there's other soft tissue. So what I mean by that is different things that are not bone. So it could be the connective tissue that connects everything together, or it could be other muscles that are around that Achilles tendon that can be causing your pain, and they come with a slightly different set of symptoms. And again, it's worth getting those checked out by a professional if you're unsure. We also have a video about that neural part and component to causing an Achilles tendinopathy, and again the link is in the information below. Our second reason is there something else in your general health that might be either causing an Achilles tendinopathy, or a reason why it's not improving, or something that means we need to adjust your rehabilitation depending on how long it takes you to recover from doing those exercises? We'll give you a couple of examples, and again these examples are something we have more information on in different videos. One is what medication you might be on. There are certain types of antibiotics that have been known to be linked to causing Achilles tendinopathy or other tendon problems within the body, and these are called fluoroquinolones. These are not first-line antibiotics and are not normally given, but it's something that you might need to be aware of. The second is whether you're taking statins or recently had statins changed, or you have been diagnosed with that and just recently been put on those. If that has started to happen with you, again, there may be links as to why this Achilles tendinopathy is causing the problems that it is and what we can do about it. And again, please look in the information below for more details. You might be going through the menopause or be perimenopausal, and there is a nice video explaining why that might be the case. Now, none of these are big problems, and indeed there are many other things that we would screen with your general health too. And what we're looking for is how then we change our management. And if, for example, we have a reason why medication might be a problem, we then might liaise with the person that's been giving you that medication, that has prescribed it to you, and see what we can do. It might mean that we change our exercises for if you have different medical conditions, like we said about the menopause, where there is more rest time that you need to have in between activity or your exercises that you're doing. Our third reason is, are you doing strength exercises? Now, when you Google what is the best exercises to do, that's me Googling, by the way, what are the best strength exercises to do for an Achilles tendon problem, you will probably come up with many, many different types. But typically the ones you see are stretching exercises, which we've talked about before in other videos, and eccentric exercises, so dropping down off that step or dropping from a calf where it's been up high and dropping down slowly. Now, strength exercises, this is a massive plethora of exercises. There are many different types. There are types which you just lift and hold, so you're just squeezing a muscle and then relaxing again. They're called isometrics. There's types where you work on the way up and on the way down. There's types where you go on and off a step. There's types where you might be jumping or hopping. There's ones where you're carrying weight. There's things where you're using gym machines. So there is such a wide range of these exercises. It's about finding which one is the correct one for you. So if you have been doing exercises that you've found on the internet or you have been prescribed, the trick is, are they too easy for you, or are they too hard for you, or do they recreate any of your symptoms? Now, recreation of symptoms is something in the research that's been shown to be okay with an Achilles tendinopathy. And again, we have a link to the pain and how we can use pain to help our rehab video that we've done before. What you're looking for is pain that is less than 0 to 3 out of 10. So 0, 1, 2, 3 is absolutely okay. Less than 3 is what we're looking for. This is something that is when you're doing those exercises, and quite typically with an Achilles tendon or tendinitis, tendinopathy, you tend to get pain in a latent response, a later on, and therefore we're also looking at that pain for the 24 hours after. So is it within that pain level? If it's too easy, we need to make it more difficult. If it's too hard, then it's not the right exercise for you. We need to make it easier. And again, this is where it's important to speak to a professional about it. What we're looking for is your envelope of function, what you can do with that niggle-only pain, that 0 to 3 out of pain for 24 hours. How strong are you? So how many repetitions can you do? Is it easy? Is it smooth movement and controlled movement? And how do we progress this on and change it? We then need to look at what else you're doing. So our fourth reason why this might not be better is, what activities are you doing outside of your home exercises or going to the gym and strengthening your Achilles tendon? And those other things could be how often you're doing your activity, how intense your activity is, how much rest you're having, whether you go through a cycle of a boom and a bust. Again, the link is below. And that boom and bust is where you might suddenly be able to do lots, and then your pain gets to a certain level, and now you have to stop for a period of time. The pain starts to settle, and then you go back up again. Maybe you're bunching all your activity and you're doing it all at the weekend because you're working really hard in the week. Maybe your work is on your feet and you've got to walk lots of steps or wear certain footwear. And these again are things that we need to look at to create a program to look at your load management, the amount of activity you're doing, so that envelope of function, as you get stronger, you can do more. And then as you get stronger again, you can do more again until you reach the target that you want to be able to do. And that target is different in different people. So we would do different strengthening exercises if, for example, you were doing a couch to 5K compared to if you were an ultramarathon runner, for example. And our final point number 5, is how long have you been doing these strengthening exercises and have they been progressed at regular intervals? So when they become too easy, they are made more difficult. That's what I mean by progression, looking at that symptom response for 24 hours when we do that. If we look at a strength regime, so if you had no problems with your Achilles and you just wanted to get stronger with your calf, when you're doing these exercises, it's going to take a number of weeks to get stronger. Like if I started going to the gym and doing sit-ups, I'm not going to all of a sudden get a 6-pack. It's going to take a number of weeks before I get better at that, and then I have to make it more difficult and get better at that again. So what you're looking at is about a 0 to 6 weeks before we start to think, oh yeah, okay, I'm getting stronger here. I can do a lot more if I compare what I could do previously. You're looking about 12 to 13 weeks before we're thinking, oh, I've got quite a good change here, and my symptoms are responding pretty well, and I'm maybe starting some of my activity again. And sometimes it can even be 6 months. And for really persistent Achilles problems, the research is showing that this progression of this rehabilitation needs to even go up to a year before we can say, right, throw in the towel here. We've tried everything we possibly can. We've progressed it. We've done it. We've applied that program. We've been consistent with it, and it's not made a massive difference. And then again, it's not just throwing in the towel and saying, I've got to live with this. There are other things that can come up. And again, we have videos on those sorts of things like shockwave therapy, or different injections, or surgery. And these come alongside more rehabilitation. So in summary, our 5 things are, have you got the right diagnosis? Our second one is there anything in your general health that needs to be applied when we're looking at a rehabilitation program? 3, have you tried strengthening exercises and are they the right ones for you? 4, what activity do you do outside of those strength exercises and how is that planned in the week? And number 5 is, have you given it enough time and have you progressed those exercises on? And as you can see, there's so many variables in that, and that's why it's important to speak to a professional who'll be able to give you a proper program that's just tailor-made for you. Thank you very much for listening, and I hope you are all well. Goodbye.